Okay, now we're going to go into activity and exercise. So I'm going to go ahead and get you to go to the next slide. A lot of this will be more of a review, and it's again looking at body alignment, our balance, and coordinated body movements. We want to make sure our patients are able to perform their ADLs and stay safe using that wide, stable base of support. Looking at our sense of gravity, our center of gravity, sorry about that, and looking at posture. Please make sure that you go through and look at the definitions for the different types of exercise and activities. Make sure you understand, again, the term friction. Okay, you've heard this in 2 different chapters now, so I guess that's a word you need to know, along with shearing force as well. When we think about transferring and positioning our patients, the most important thing is keeping our patients safe on their transfer. And so we're going to go through a lot of that in our lab. Please make sure that you look through your chapters, look at the procedures, tables, anything that shows safety, exercise, transfers. Please make sure that you go through and look at those. Also, again, the pathological influences about body alignment, mobility, and activities. Again, congenital defects can also cause a problem such as scoliosis. It gives the body improper alignments, so it throws off their balance. Also, we have to think about disorders of the joints, the bones, the muscles, such as arthritis, osteoarthritis, inflammation, of the joints, any kind of damages, and any type of musculoskeletal trauma that may have happened to our patients too. So we take all that into consideration with transfer and positioning our patients. Again, we're going to look at ergonomics. We're going to assess our patient, look at their diagnosis, what kind of criteria we're looking at. We're going to look at safe handling and movement of our patient. Sometimes we have to use special equipment such as sliding boards or a lift. We also want to make sure that we protect our backs as nurses. That's one of the biggest injuries in nursing. Again, after the fact, review and say, okay, what did we do? What could we have done better? And then there is what we call a no-lift policy, where we don't lift our patients, we move them, and that's why we use the special equipment to move our patients. And again, we're going to, most important is keeping our patients safe when we transfer them, and knowing if you need to have more than one person. You need to assess your patient, their situation, and figure out how many people you need to do this transfer. Again, when we look at activity and exercise, we're going to think about our developmental changes at the different stages. Also looking behavioral aspects. Yeah, if someone's around them to support them, patients are definitely going to want to incorporate exercise into their program or their plan of care. There's definitely different influences on activity and exercise, work site, schools, community, a family. If someone's always been into fitness, they're going to see it's very instrumental to their lives. Children who are less active are going to usually end up with childhood obesity. Physical fitness is key health promotion for our patients, and taking care of yourselves. Different cultures may view differently as well. So these are some things that you want to look into and read over in your textbook. Always make sure you do a thorough assessment, looking at, again, the alignment of the body and their posture. Look at, normal physiological changes that are happening, and then, of course, any deviations in that in your patient. So in your assessment, you're going to have your patient stand, and you're going to look them over. Then again, you're going to have them sit and look them over again. When they're lying back, and then we're going to watch them move. We're going to watch them walk. Look at their gait, their cadence, their balance as they're moving along. Are they able to tolerate it? How far can they walk without getting short of breath, or their heart rate going up, or their blood pressure going up? So do they have activity intolerance, or do they have an intolerance? Here's some possible nursing diagnoses that go along with activity and exercise. Here's a quick quiz question. And your answer should be D. So when we're getting our patients to walk, we want to see, assess their ability to walk. If they are a little weak or a little unsteady, I'm definitely going to have a gait belt. If they're, when I get them up, I'm going to get them up slowly, dangle their bed, dangle their legs, not dangle their bed, but dangle their legs off the side of their bed for about a minute or two, help them get their bearings. I'm going to help support them at the waist, so that their center of gravity remains midline, and that's with that gait belt. And again, I make sure I show the patient how to properly transfer, and if I need any assistance. And I'm also going to show the family how to safely transfer the patient, make sure that they have non-skid shoes, something on their feet. I'm going to also look to see, do they need a walker? Do they need a cane? Do they need a crutch? And so we're going to go over those. So please review that for, especially for lab, because they do love those questions, especially about crutches, crutch walking on boards. Again, with restorative activity and chronic illnesses, these are some, definitely some diseases that exercise and activity can really help to restore our patients. And so please read through that section and underneath that particular slide as well. And then, as always, we're going to evaluate.